In the United Kingdom, all skin cancer services are made up of a variety of subspecialties, such as dermatology and plastic surgery, that are interested in helping people with skin cancer. The dermatology doctors often get involved with the simpler operations, and the plastic surgeons are usually more involved with the bigger operations if the skin cancer has got larger. So most of the skin cancer that I do is in fact local anesthetic, day case surgery. And if you had a small basal cell carcinoma, for example, then an elliptical excision with a linear closure with dissolvable stitches would take 20 to 30 minutes, and it's a simple solution. If, however, the skin cancer was larger and involved areas of the face like the nose or eyelid or ear, then you might need reconstruction to make the area look as normal as possible after the surgery. And that is really where the skill of the plastic surgeon comes into its own. So usually the skin cancers are small and reconstructive surgery is not required. All you need is for your surgeon to be able to remove the skin cancer, roots and all, and to close the wound neatly so that the final scar is well mended and hard to see. It's only if the skin cancer involves a critical area of your face, nose, lip, eyelid, or ear, for example, or the skin cancer is large, that you may need reconstructive surgery. And plastic surgeons have a reconstructive toolbox, and depending on where the defect is, how deep it is, how big it is, we select from the toolbox the appropriate procedure. The most important thing I think about this is that a full, open and transparent discussion is had between patient and surgeon about what to do. In plastic surgery, the diagnosis is usually relatively straightforward, but we have a variety of therapeutic interventions, different treatments, and it's these different treatments that we need to discuss in some detail before the best treatment for you is planned. The immediate care of the wound after the surgery would be to leave the dressing in place, usually for a minimum of 3 to 4 days. But if the dressing is well adherent and there is no sign of trouble, you could usually leave the dressing over the wound until you see me in a week's time for an early wound check and histopathology discussion. The scar itself takes many months for it to mend fully. So when the dressing is removed, the scar will look like a fine line, usually. But over about 6 weeks or so, it becomes lumpy and red and itchy. And this is normal wound healing. And then massage techniques with a moisturizing cream and patience, as this takes 6 to 9 to 12 months to mend fully. At the end of the healing period, the lumpy red scar should have become soft, flat, pale, and hard to see. So that's how to look after the scar. How you look after all of your skin is, if you've had a skin cancer, your body is telling you something. It is telling you that you've seen too much sun. So a sensible approach to sun exposure, using a factor 20 or 30 sun protection cream when you're out and about, long cotton sleeve shirts and a broad brimmed hat to protect your face from the sun if you're in a hot climate, And also, don't go out in the middle of the day if you're in the tropics where the sun is extreme. So simple things: keep your skin moisturized, don't get sunburned, and of course, be vigilant to all of your skin once you've had a skin cancer, because your chances of getting another skin cancer are higher than the average population. So 3 or 4 times a year, you'd stand in the bright light of the bathroom, you would check the front of your body, and your partner would check the back of your body for anything new, anything changing. And if you did find that, what you would do is take a photograph with a ruler close by of the lesion that you're concerned about, and you'd send that picture to me, and I can have a look at it. It also serves as a record for future examinations at home in the bathroom. You can compare whether there's been a change to the lesion or not. So that's a useful way to look after things. The main benefit of having a plastic surgeon involved in your skin cancer treatment is that the skin cancer management usually involves diagnosis, which the dermatologists are usually very good at. The plastic surgeons are also good, but the dermatologists are expert at dermoscopy and mole recognition and melanoma recognition in changing moles. So that's the diagnostic component. But then there is the treatment, the therapeutic component. And the plastic surgeon is the expert with the therapeutic component. So usually you would need both dermatologist and plastic surgeon involved in your skin cancer to help you.